Hey, how you doing? This is Adam Post, publisher of more than 1,000 comic books and marketing expert covering woke medical schools panic as new law bans DEI in medical schools. Let's get into the story. Before we do, please be sure you are subscribed to the channel. Click the bell for notifications. Give me a thumbs up. I really appreciate you guys. Anti-DEI legislation threatens medical school diversity. Yes, medical school diversity is under threat because the American Medical Association and multiple medical schools are now pushing diversity over merit. There have been lower standards for a very long time in medical schools. But in the last few years, along with the rest of DEI destroying merit in colleges, in the workplace, in government, everywhere, it also got to medical schools. So Congress is pushing back with a law to ban this. From Wall Street Journal opinion, ban DEI quackery in medical schools. A new bill would deny money to institutions that engage in the worst practices. This would prevent federal funding for medical schools that are pushing diversity instead of quality care, instead of merit. And they're doing it under the premise of what they consider fairness. It's not fair if certain people of certain genders or certain skin colors don't do well in medical school. So reduce the standards. And their other premise is, if you see someone who looks like you by skin color or by gender or sexual preference, when you go in to see a doctor, you might trust them more. And as a result, you might follow their instructions. And if you're more comfortable with your doctor and you follow their instructions better, it could lead to better medical outcomes. Sure, that's possible. But primarily, you do actually want a good medical professional taking care of you or your family member when you need to see a doctor, even if it's just for a checkup or if it's for some serious medical issue. Of everything going on with DEI, and thank goodness DEI is getting challenged everywhere now and it's starting to get rolled back, this has to be the scariest, where they're lowering the quality of the people who are allowed to give you medical advice. And God only knows what this is going to do to malpractice insurance. Everyone is going to be paying more for medical care and more for insurance coverage because there are going to be many, many more malpractice claims. It doesn't take a genius to figure that one out. If your doctor isn't qualified, you're going to get hurt. And then you're going to be able to sue them. And then the insurance rates are going to go up. From nonprofitquarterly.org, anti-DEI legislation threatens medical school diversity. The Educate Act, a bill recently introduced to Congress, would effectively ban diversity, equity, and inclusion efforts in medical schools by restricting federal funding. Drawing upon an extreme version of colorblind politics, the bill would bar graduate medical schools from distinguishing students by race, color, or ethnicity, or from using race, color, or ethnicity to establish privileges or benefits for students. So you couldn't just say, I want all my students of this certain color to get this free grant money, or this program that's only available for people that look like them and not other people. The bill also effectively bans courses for students based on race, color, or ethnicity and instruction, so no reparations in your medical care, whether you're a doctor or a patient. And I know that sounds ridiculous, but that's what this is. It's a catch-all, so they can't do ridiculous things. The bill cuts federal funding for any DEI office that serves a graduate medical school, which could lead to the closure of DEI offices at institutions of higher education all over the country. It doesn't mean they can't get their own funding. It just means they can't waste federal funding this way. They can't make us all pay for it with our taxes. The bill would also require government agencies and associations to demonstrate, quote, the agency or association does not require an institution or program to adopt any DEI policies or other requirements. So they can't force DEI as part of the institution's authority, which they have already done. The federal funding would say, well, you're not going to get federal dollars if you push your agenda with the power of your medical institution. An agenda that so far can only exist if it wastes federal funds on it. The bill goes so far as to also ban DEI efforts within research operations at medical schools, student organization operations, and the invitation of lecturers and other guest speakers. So you can't use federal funds to bring in your crazy DEI consultants and your crazy DEI speakers. And no, you can't do your phony research that tries to justify these efforts and do that at federal funding expense. It's all about money. The Educate Act was proposed by Representative Greg Murphy of North Carolina, who co-authored an article in the Wall Street Journal, Ban DEI Quackery in Medical Schools. That's this one. In the article, Murphy and co-author Stanley Goldfarb argue that the ideology of diversity, equity, and inclusion is dangerous everywhere, but especially in medical education. The article reads as a preamble to the bill, which equates efforts to diversify medical schools or promote culturally competent care, which is terrible medical care based only on your skin color, as if you're a different species and you're not a human being. There is no such thing as culturally competent care. We are all human beings. We need to all be treated equally. And if we have special needs, it's not based on our skin color or our culture. The term culturally competent care is to try to change the rules of medicine, to comply with the nonsensical woke ideas. And when they say culturally competent care, this is what they mean. Culturally competent care is the ability of healthcare systems to provide personalized care to patients with different values, beliefs, and behaviors, and dialectical needs. Cultural competence is important for addressing health disparities and improving patient outcomes. So if you have different personal values and beliefs and behaviors and special cultural needs, we're going to treat you differently than if you're just another human being. This is why they call this quackery in medical schools. And Dr. Goldfarb, who co-wrote this article, also founded this really important organization called Do No Harm. Do No Harm represents physicians, nurses, medical students, patients, and policymakers focused on keeping identity politics out of medical education, research, and clinical practice. And they have had a number of successes. I've covered their successes before. Just know these are doctors, these are professionals, and they care about what happens to people. The article, which promotes the main point addressed in the bill, takes issue with medical school courses on health equity and health justice, systemic racism, and colonialism. All nonsense concepts that have no business anywhere near medical treatment. According to Murphy and Dr. Goldfarb, quote, medical schools teach about intersectionality, colonization, and white supremacy, while promoting the idea that people are either oppressors or oppressed. They also point to affinity groups based on race and loyalty oaths within DEI statements as part of a dangerous and contagious philosophy. In a contrary article, Wall Street Journal also published, what are they teaching in medical school? DEI in no way replaces a strong focus on the latest science and evidence, writes the Association of American Medical Colleges. Because what they call the latest science and evidence is not real science. It's not hard science. It's their insane social science. And they're trying to push it into medical schools. And unfortunately, they've been very successful. And that's why we need a law like the Educate Act. In a letter to the Wall Street Journal, several scholars and medical practitioners responded and refuted Murphy and Goldfarb's claims that DEI programming and instruction on racism and discrimination in medical settings worsens the quality of medical education. Well, of course it does. It's a complete waste of time. Why would you ever need to talk about ideas with racism and whatever else in a medical setting? People are human beings. This is all about dehumanizing people. And that's what Murphy and Goldfarb are pushing back against. David Skorton, president and CEO of the Association of American Medical Colleges, and Allison Whelan, AAMC's chief academic officer, wrote that teaching related to DEI, health equity, and the care of our diverse population supplements, but in no way replaces, a strong focus on the latest science and evidence on human health and disease. They go on to assert that a growing body of scientific evidence indicates clear benefits of adding diverse perspectives and seeing each patient as who they are, formed by their individual experiences. This is important not only for marginalized populations, but for all patients. And with this fake DEI science, they have been hurting vulnerable communities. However, they're accusing the people who are trying to protect medical care of actually hurting vulnerable communities. If enacted, the bill would threaten the quality and accessibility of healthcare for vulnerable communities. The diversity of the physician workforce impacts patient care in several ways. No, it doesn't, but here's what they're saying. Diversifying the physician workforce increases the number of physicians and other healthcare providers for those who live in medical deserts. Medical deserts are defined as areas where population healthcare needs are unmet partially or totally due to lack of adequate access or improper quality of healthcare services caused by insufficient human resources in health or facilities, long waiting times, disproportionate high costs of services, and more. So by lowering the standards of the people who are providing medical care, they can fix their medical deserts. That's their strategy. Since people from vulnerable communities are more satisfied with their care and more likely to receive preventative care when they have access to doctors who share their lived experiences, the diversity of the physician workforce also impacts the quality of care these communities actually receive. Colorblind policies like those reflected in the Educate Act operate on the assumption that fairness and equity already exist, and that any programs that target a specific group are therefore inherently racist or unjust. However, such a view neglects the long history of discrimination and systemic racism in the United States, as well as in the professionalization of medicine and medical education. The bottom line is this: either you have the skills to do the job or you don't. If you're going to say you're not getting enough people that look like me because your standards are too high, you can't lower the standards to solve that problem. You have to increase the quality of the people that look a certain way. That's the only way to do it. And when I say quality, not good person or bad person, I'm talking about skill set. I'm talking about dedication to learning. Maybe create a separate program where people can spend more time in nursing and then move from nursing to becoming doctors. Nurses do already do that. If you want to incentivize that and make a real case, go make a case for it. But don't say you need to lower the standards because we need to have more people in medical deserts that look a certain way to match the population, but that don't actually have skills. All that's going to do is raise everybody's malpractice insurance, while people get hurt by inadequate doctors. As medicine became institutionalized and professionalized, medical schools and medical associations, for instance, refused entry to African Americans and other groups. Really? When was that? When? In the 1910s? The 1940s? I don't know. Was it within the last 100 years even? Because that's not what's been going on for the last several decades, any relevant amount of time that you haven't experienced in America. And even so, what was the standard of care? We're talking about medical care. What was the medical care in the 1940s or the 1950s when they did this? And I don't know when they did this. I know they haven't been doing this for decades. I know whenever this happened, because they claim it happened, so let's say it happened, it wasn't in the last 10 years, not the last 20 years, probably not the last 50 or 60 years. So how is this relevant to today? Lower the standards now so that we have less medical care quality than we did in the 1950s? Just so we can try to change the skin color of the people who we call doctors? Currently, the medical student body is predominantly male and white, and the faculty at medical schools skew heavily towards white men. Yeah, so what? While there have been some progress in diversifying medical school student populations in recent years, the anti-DEI backlash within medicine is likely to stymie progress in creating a more diverse workforce of healthcare professionals to serve an increasingly diverse nation. No, it won't have any negative effects on the quality of care. The backlash will have effects preventing these guys from lowering standards for medical care. And that's the right kind of backlash. But in the bigger picture, the Educate Act comes on the heels of several anti-DEI efforts within the nonprofit and for-profit landscape. The Supreme Court decisions in Students for Fair Admissions versus Harvard and the University of North Carolina to end race-conscious admissions had already threatened the diversity of the medical student body as well, and also affects programs in all other disciplines. According to Axios, the anti-DEI backlash has been ramping up at the state level before the Harvard and UNC cases were decided. Since 2021, 21 states proposed bills to dismantle DEI programs on college campuses, with many of those states being successful getting rid of these ridiculous programs. The U.S. House Office of Diversity and Inclusion was disbanded by a government spending bill, and the Fearless Fund's protracted legal battle on the validity of its Fearless Strivers Grant Contest, which provides grants of up to $20,000 to Black women-owned small businesses and only Black women-owned small businesses, is yet another instance of the growing contested ground of DEI initiatives, race-conscious policies, and justice-centered programming. It's all getting taken away. The Educate Act essentially argues that there is no need to adapt policies and procedures to provide better care for vulnerable communities that have a centuries-long history of exclusion and discrimination in the healthcare system. Because, of course, there is no need to treat people with different skin colors like they're not human beings. We're all human beings. And we all deserve to be treated as human beings, not human beings with this skin color or that skin color. Though anti-DEI efforts only attack people of color and the instruction and programming meant to draw critical attention to their unique healthcare experiences, as David Scorden and Allison Whelan point out, many DEI policies benefit all patients. Therefore, it is all of America that stands to suffer the consequences of efforts to abolish DEI in medical schools. Whether it's from this new law in Congress or whether it's through lawsuits, DEI will be removed from medical schools. We would love to see that happen immediately. It might take some more time, but it will get done because human beings do not need to be treated differently based on their skin color. We do not want to lower standards for professionals who are doing medical care on adults or children. We want high standards. We want higher and higher standards, not excuses, not nonsense, and not discriminatory programs. Let me know what you think of all this in the comments below. Always love to see your ideas. Please be sure you are subscribed to the channel. Click the bell for notifications, give me a thumbs up, and I'll see you again soon with another story. And if I don't see you, I will miss you.